Welcome to the Endo Kids podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care. Hi, everyone, and welcome back to Endo Kids, the Endo Kids podcast, where little hormones meet big answers. The podcast where we break down pediatric endocrinology topics into practical, real-life conversations for families. I'm Dr. Mehra.
And I'm Dr. Waldman. We're pediatric endocrinologists, which mean we focus on hormones, growth, and development in children. And today we're taking a deeper dive into something that affects every child, bone health. This episode is a more detailed look at how bones develop, what can go wrong, and what families can actually do day to day to support strong, healthy skeletons. So whether you're a parent, caregiver, or even a curious teen listening along, this is for you.
So let's start by reframing something. Bones are not just structural support. They're actually dynamic organs. So bones are actually metabolically active tissue, and bone responds to hormones, nutrition, and mechanical forces. There are three main types of cells involved. So there's osteoblasts, which build new bone, osteoclasts, which break down old bone, and osteocytes, which are mature cells that help regulate bone turnover.
In children, bone formation exceeds bone breakdown. That's why bones grow in size, thickness, and density. There's two important topics for families to understand. One is the bone size, how big and the different shape that the bone is. And the other is the bone density, also known as the mineralization. And that's how strong and compact it is. Now, both of these things matter. A larger bone with good structure can sometimes be stronger, even if the density isn't.
Now, one of the most important features in children's bones is the growth plate. So the growth plate is an area of cartilage near the ends of long bones where lengthening occurs. Growth plates are softer than mature bone, which is why kids are more prone to certain types of fractures. As puberty progresses, growth plates gradually close under the influence of hormones, especially estrogen in both boys and girls. And once they close, bones stop growing in length.
And you might remember this topic from when we talked about growth. And we talked about getting something called a bone age or an x-ray of the left hand. And that's when we know that the significant growth in height is done. So, we had talked about how hormones influence growth, puberty hormones, growth hormone. That's going to come into play a little bit later. When we think about how strong a bone is, we think about the peak bone mass. That's the maximum bone density and strength that a person can achieve in their bones. And about 40 to 60% of bone mass is accumulated during adolescence alone. It is such an important time. And roughly 90% of that is achieved by late adolescence or early adulthood. And if you think of it like this, if your child builds strong bones early, then they start adulthood with a higher reserve. This is so, so important. And that this reserve protects against future bone loss and fractures later in life.
So let's get more specific about nutrition, because this is where families often want actionable guidance. So we're going to talk a little bit about, beyond just the thought of drinking milk and how that helps bone health. So calcium requirements for kids vary. And so they do vary by age. There's generally some daily calcium needs. So for kids age 1 to 3, the daily calcium need is about For kids age 4 to 8, it's about 1,000 milligrams. And for kids age 9 to 18, it's about 1,300 milligrams a day. And it's really important to understand that the body absorbs calcium best in smaller amounts throughout the day, not all at once. So it's really important for an adolescent who, we say needs about 1,300 milligrams a day for them not to get that all at once, but to get that throughout the day. So, Dr. Waldman, do you want to give us some examples of some calcium rich foods?
Absolutely. So, obviously, everyone's first thought goes straight to milk, and that is a great source of calcium. In about a cup of milk, you have about 300 milligrams of calcium. So, that is a great source, but there's lots of others. So, in 1 cup of yogurt, you have a similar amount of calcium, about 250 to 300 milligrams of calcium. An ounce of cheese, which really is not that much, also has about 200 milligrams of calcium. So that's if your child is a cheese eater, and certainly mine is, that's a very easy way to get in calcium. There's also fortified plant milks. So milk coming from a cow is not the only kind that has calcium. There are other types of milk that are fortified with calcium, and that the amount of calcium in them can vary, but it definitely is a good significant amount. Calcium set tofu is a great source of calcium, as well as leafy greens. Now, they have a lower amount, but they're still a great source of calcium. Things like kale and bok choy. Spinach has some calcium, but it's not quite as well absorbed. Now, still, everyone should eat their spinach. Don't be upset about that, but it might not be the best source of calcium that we have.
Yeah, and then let's talk a little bit about vitamin D because talked about vitamin D as really the gatekeeper. Vitamin D is really essential because it allows calcium to be absorbed in the intestine. And without enough vitamin D, even a high calcium diet will not be effective. Most children need about 600 international units of vitamin D a day. And Dr. Waldman, do you want to talk us through some sources of vitamin D?
Absolutely. My favorite one to talk about is sunlight. So, going out in the sunshine for just a few minutes a day, you can get your vitamin D for the day. Certainly, the amount that is absorbed by the skin varies based on the season, based on your skin tone, whether you use sunscreen. But getting some sunlight is good for your vitamin D. I also think it's always good for mental health as well. But there also are other foods that are high in vitamin D. There are fortified foods such as milks and cereals. Also, fatty fish such as salmon is a great source. And then, of course, there are supplements if your diet just doesn't allow enough vitamin D in it.
The other key ingredients are proteins, but there's other nutrients as well, like phosphorus, which pairs with calcium, magnesium, which also supports bone structure, and vitamin K, which is also involved in bone mineralization. But really, balanced nutrition matters more than any of these single super nutrients that we're talking about. So let's talk a little bit also about physical activity and the science of loading bones.
Yeah, so bones responds to mechanical loading. So stress placed on the bone is really important. It helps the bones adapt to that stress, that the forces are on it, and become stronger. So high impact weight bearing activities actually stimulate bone formation. Some of these activities include jumping, hopping, running, gymnastics, basketball, soccer, dance. There are so many out there that are going to help to make bones stronger. Interestingly, short bursts of high impact activity are especially effective. So, that sometimes we talk about HIIT activity. That's really effective for strong bones. Swimming and cycling, they're great for cardiovascular health, less effective for bone density because they're not necessarily weight bearing, but still wonderful sources of exercise. Just like Dr. Maris said, as far as nutrition, getting in a well balanced diet is important, and also balancing your physical activity. So, not just doing one type of activity all the time, kind of balancing them out will help to make strong bones.
Exactly. And, I wanted to talk a little bit about the endocrine connection because we do talk a lot about hormones. And so let's talk a little about what this means and the key hormones for bone health, because this is where our specialty comes in. So we talk a lot about growth hormone, and we've talked about growth hormone in past episodes, but growth hormone does stimulate bone growth and bone turnover. And one of the hormones, IGF-1, that we talk about a lot when if you come see us in our office, helps with many of the effects of growth hormone. And it does help stimulate bone growth. Estrogen is also critical for bone density in both sexes. So both sexes, both males and females, make estrogen. And this is really critical for bone density. And then testosterone contributes to the bone size and strength. So these are very important, but estrogen is the most important hormone for closing the growth plates and increasing bone density, even in boys. And we talk about this if you come see us in our office, really about why estrogen is important for that reason. But when the hormones are imbalanced, these conditions can affect bone health. So, for example, in growth hormone deficiency or delayed puberty, we talk a lot about supplementing with calcium or vitamin D, and also in children who are not going through puberty, in thyroid conditions, especially hyperthyroidism or Cushing's syndrome. Sometimes these conditions affect your bone health and bone density.
We also know that chronic stress hormones like cortisol can weaken bones over time. So, again, it is really, really important that if you're worried about bone health for any reason, to talk to your child's pediatrician or pediatric endocrinologist about these certain things. We know that there are some children who also have additional risk factors for problems with bone health. And these can include children or even adults who have celiac disease. We know that that can affect nutrient absorption. Anyone with inflammatory bowel disease, so Crohn's or ulcerative colitis, certainly juvenile arthritis and chronic kidney disease can also lead to potential problems with bone health. In addition, we know that there are certain medications that can affect bone health. So, long term steroids are a major risk factor, not necessarily the very short burst that you might get for something like an asthma attack, but someone who's on steroids for a prolonged period of time. There are also some anti seizure medications that can affect vitamin D absorption and metabolism as well.
Yeah. And, in kids, we don't just look at the bone density numbers. I mean, people ask us about doing bone density in kids. We don't just look at the bone density numbers, but we really look at the whole picture. And so, if somebody comes to us for an evaluation, we usually do ask about their fracture history. So, not just if they fractured, while doing sport or activity, but did they ever fracture just, tripping or not doing much at all, really. We really want to know what their history is and how many fractures did they have and over what period of time. I think that's important for parents to keep track of. And then we look at growth patterns. So we're always looking at growth in kids and looking at their growth patterns and seeing if there's anything that we need to test for more carefully. And then looking at underlying conditions, like Dr. Waldman said. So, do they have any issues with absorption? Should we evaluate for celiac disease? Those are really important. Have they been on any steroids? And if they have had frequent fractures, sometimes we will recommend a bone density scan, or, which is also called a DEXA scan. And unlike adults, we do compare bone density to age, sex, and size. So, really important to have a pediatric physician, pediatric endocrinologist, pediatric orthopedic, somebody who is well versed in looking at pediatric data on the DEXA scans and not just getting adult data. That's really important. So, Dr. Waldman, do you want to talk to us a little bit about some red flags for families that might prompt further evaluation?
Yes. So there are certain signs that should definitely prompt someone to speak with their pediatrician or pediatric endocrinologist. One of those is if you have two or more long bone fractures before the age of 10. So, not necessarily a pinky fracture, not necessarily a toe fracture, but two or more of those long bone fractures before the age of 10. Three or more before the age of 19. If you have any vertebral or spine fractures, that's definitely a red flag. Certainly, if you have some poor growth or delayed puberty along with problems with fractures, that can be a sign of a problem, or any chronic illness or restricted diet, or those medications that we talked about earlier. If you notice any of these or are worried, this is a great time to talk to a pediatric endocrinologist.
Yeah. And, let's bring this back to everyday life. So, some practical daily strategies for bone health. So, if you want to talk about building a, quote unquote, bone friendly day, and what kind of food or diet you should introduce to your kids. Bone healthy foods include, for example, for breakfast, a calcium fortified cereal with milk or yogurt. Okay, so you can include that in your child's diet. And then the afternoon, making sure your child is playing outside and getting direct sunlight, because, like Dr. Waldman said, vitamin D is the number one way that our bodies make vitamin. It's so super important to look at that. And then, for a snack, like Dr. Waldman talked about, getting some cheese, almonds, or a fortified smoothie, and then a balanced dinner with protein and vegetables. And in our house, we do try to include milk at every meal. I think some, people have some concerns about, getting milk and the hormones in milk. And I've heard a lot of questions about that. So we can discuss that at a later podcast. Getting, really three sources of milk, cheese, or yogurt in your diet every day is usually my recommendation.
And on the other side of it, there's certainly some things or habits that you want to be careful of and moderate, limiting soda for so many reasons, but also because it can displace calcium rich drinks. So it can it can decrease the calcium metabolism. And so you definitely want to decrease or limit the amount of soda, avoiding excessive caffeine in teens. You definitely want to encourage consistent meals and promoting sleep because we know that growth hormone is released during sleep time. So, all of those things you want to make sure of as well. We also want to think about certain groups of people who might want to think about calcium a little bit harder, really take it into account. So, certainly athletes, especially in sports where they're emphasizing leanness. So, if you think about gymnasts, we want to make sure that if there is anything like a restricted diet, that they're still getting in enough calcium and the other minerals. Anyone with an eating disorder, of course, we want to be on high alert for their bone health and
Mhm.
children with limited mobility. So, because you are not getting that weight bearing exercise, they are at increased risk of problems with bone health. So, we do want to make sure that we're watching and making sure that they're getting in enough of those nutrients. They can often benefit from multidisciplinary care, including pediatric endocrinologists on their team. So, Dr. Mehra, I have some common concerns or questions that some parents might ask. Are you ready?
Sure. Yes,
Right. So
absolutely.
the first one that I hear often is my child doesn't drink milk or they absolutely hate milk. Should I be worried and what should I do?
So, not necessarily. I mean, milk, like I said, is just one source of calcium. So, there's other sources of calcium as well. There's fortified plant milks, there's tofu, there's almonds, there's leafy greens. But you do want to make sure your child is getting enough calcium overall. So, milk is just one source, but really trying to make sure that your child is getting enough. And I often tell parents, I mean, I see so many adolescents who are just really not getting enough calcium in their diet. They either don't like the taste of milk. Adolescence is kind of a tricky time. Me being a parent of two teens right now, I sort of see their palates changing. And I do feel like they don't necessarily always want to have some of these calcium sources, but really providing, something as an alternative. And then I'm not opposed to doing some, supplements. And so I think we should, talk about that a little bit. So, Dr. Waldman, what is your thought about, your child taking calcium supplements or vitamin D?
Yeah, I'm a big fan, especially if you know that their diet is limited, right? If you have a child who loves milk, yogurt, cheese, all of those things, it's probably unnecessary. But if you have a child like many of us do who doesn't like the taste of milk or their palates change, or, again, even if it's a season of that where their diet changes somewhat, there's absolutely nothing wrong with supplementing calcium and vitamin D in their diet. Again, we want to make sure that they're building that healthy bone in adolescence. We know it's the most important time, like we talked about earlier. So we want to make sure that they're getting enough. Now, again, we don't want to exceed too much, right? That's not necessarily a better thing. But again, if you know that your child just is not getting enough through their daily diet, there's nothing wrong with doing supplementing.
I mean, I agree with that, and so that's usually what I tell my adolescent, patients who come in, that if you're really not taking enough, just make sure you get a calcium and a vitamin D supplement. So I think that's, we're on the same page. as far as that's concerned.
And what about the question is, they come to you and they say, my child broke a bone. Is that normal? Should I be worried?
Yeah, so kids do break bones. I think both of us have had kids who have broken bones, and it does happen. But frequent fractures, especially from minor injuries, can be a red flag. And that's when we start thinking about underlying bone health issues. So, if your child has had, one fracture with, playing a sport, basketball or football or something like that, maybe not a big deal. But if there's multiple fractures or fractures that happen when there's otherwise just walking or they haven't done anything, then that's a reason to get an evaluation. And, we can certainly help with that. Your pediatrician can certainly help with that as well. So let's talk a little bit about some myth busting. Okay. So Dr. Waldman, only older adults need to worry about bones. What do you think about that one?
That is not true. We told you earlier that adolescence and even late adolescence is when we lay down the majority of our bone mass that we have for the rest of our lives. So, no, we need to think about bone health all the time. We want to make sure that we're getting in the physical activity, all of the nutrients, that well balanced diet. And, we have that weight bearing activity even as children and adolescents. So, absolutely false. We need to think about our bones all the time.
Yeah, and what about the claim that more calcium is always better? So, what do you think about that? So, if you take a little bit of calcium, is it better to take more or even large supplements? What do you think about that?
So I disagree. So too much is too much. We don't want too much. We want to make sure that we're meeting those daily recommended amounts that we talked about earlier. And again, whether it's through diet or if we can't make it through diet, through supplements, that's important. But going to the nth degree, taking excessive amounts is not a good thing. It can lead to other problems that you don't want to deal with. So you really want to make sure that you're balancing. And so again, too much is not good. And we also mentioned earlier that calcium is best absorbed small amounts throughout the day. So you don't want to take in a massive amount at breakfast and then none the rest of the day. You're much better off kind of spreading it throughout the day.
Yeah, exactly. I agree. Okay, and then what about the claim that skinny kids have weaker bones? So, what do you think about that one?
That is not necessarily true. Skinny kids can have a low body weight, but they still can have strong bones. Now, if we're talking about someone is on the leaner side because they have restricted eating, that's a different conversation. But just because a child is lean does not mean that they have weaker bones. Again, a lean child should be taking in the same recommended amount of calcium. They should be getting physical activity, all of those things. So again, that this thinner, leaner child is not necessarily have weaker bones. If they're very low body weight or again have those restricted diets, yes, that can be a concern for sure.
Okay, yeah. And then how about exercise? So, can exercise really change bone strength?
Absolutely. So, bone health is impacted by that weight bearing exercise. It is so important. And so, getting in the running, jumping, gymnastics, soccer, basketball, almost anything is weight bearing. And that is absolutely super important to build strong bones. And that is important later on in life, also. We know that. So, from children until adulthood.
Yeah. And so, I'm going to talk a little bit now about just talking to kids. Your kids are listening. And if kids are listening to this podcast while you're in the car or, out walking around, really you need to think about your bones like a savings account. So every time you jump, you run, you eat healthy foods, you're depositing, something in your body to make your bones stronger. So you're making your bones stronger for the future. And bone health really is built over years, not days. So you don't need to be perfect. You just need it to be consistent, and nutrition, movement, and healthy growth all work together. And the habits your family builds now can have a lifelong impact.
Thank you so much
Uh,
for joining us on this deeper dive into pediatric bone health. If this episode was helpful, please share it with another family member, caregiver, friend. And as always, we keep building those strong foundations. If you want further information, please join us at endokidsconcierge.com. We're happy to talk to you or even see you in person. And hopefully, we'll see you again on the next podcast episode.
okay. Thanks, everybody. We'll see you next time.
Thank you so much for joining us on the Endo Kids podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.